everybody, Dr. Manohar here from Roundbarn Dental. Hope everyone is excited for Labor Day weekend. I am so ready for the long weekend, but wanted to jump on live for our weekly Tooth Talk series. So if you guys have been following our practice, we are also doing a Project Smile Makeover contest for this month. We are giving away a brand new smile to someone local in our area. So if you are in or near Walnut Creek or even in the greater East Bay area, do not miss out on this opportunity. It could be anything from exams, cleanings, x-rays, fillings to crowns, even veneers. I will put the details on how to enter in our description box below. The deadline to apply is the 15th, so be sure to check it out. Today, the topic we picked is, what are the options to replace a missing tooth? Here at our office, we give a lot of emphasis on preventive care. But sometimes, for some unforeseen reason, let's say you lose a tooth and now we have to replace it. Before we go into the details of replacing, let's see what happens when you lose a tooth. First of all, when you have a full set of teeth, the forces of chewing are equally distributed among all teeth. But when you lose one or more teeth, the forces gets redirected to the adjacent teeth. Because of the increased amount of forces, they slowly get weaker and your teeth starts shifting, causing problems with your bite. The tooth on top, let's say you're missing this tooth right here. The tooth on top can come down as there's nothing to stop in its place, and the tooth on even the sides can move into the space. The other thing that can happen is bone resorption. Having a full set of teeth is what keeping your jawbone full and healthy. Imagine someone who has lost all their teeth. What is the first thing that you notice? They lose the fullness of their face and they look very aged. That's because when they have no teeth, the jawbone gets resorbed. Like any other part of your body, when you do not use it for a long time, it gets atrophied. The same thing happens with your teeth. Whether you lose one tooth or multiple teeth, the jawbones get resorbed, and once the bone is lost, the gums attached to the tooth gets pulled down as well, causing recession on the adjacent teeth. So now you have an idea of what happens when you lose a tooth. Let's get on to what we can do to replace a missing tooth. So option number one is to have something removable. It can be with hooks. We call it a partial. Can be metal or acrylic. So when you are missing multiple teeth, this could be a good option. The pros are it is the cheaper option and it replaces multiple teeth all at once. The cons is because it's removable, you have to remove it every night. It will never feel like it's a part of you. It takes a lot of practice on getting used to eating, chewing, talking. You sometimes have a lisp with it. The tongue has to get used to it, and it is very, very hard. And it has to be adjusted multiple times. The option two is a bridge. So something like this. So like its name suggests, it connects two adjacent teeth and you have a fake tooth in the middle. The pros is it's fixed and it's very aesthetic. But the con is we have to drill down two adjacent teeth, and if in the long run, if you end up losing one of the tooth, the whole bridge, one of these anchor tooth, the whole bridge needs to be replaced. And cleaning underneath that fake teeth can be very difficult and you cannot floss in between them. So the option three is an implant like this right here. Implant is a metal post that goes in place of where the root of the tooth was. Most of the time, we send you to an oral surgeon's office to get the implant portion done. It takes, and then you come to us for the crown that goes on top of the implant, right? It is a fixed option and you do not have to touch the tooth next door and you can floss in between. So it's a much more healthier option. The con is it is a longer process. It takes 4 to 6 months for the bone to really attach to the implant, and it's expensive. It is one of the expensive options. Of all the options discussed here, the implant is the only option that preserves the bone. That's why most of our patients prefer this option. To summarize, the options are to get a removable partial that goes in and out, or a bridge where we drill down the adjacent teeth, or to get an implant. Let us know if you have any questions regarding these options. I want to thank Lorna Del Castillo for suggesting this topic for today. If you have any other topic that you would like to discuss in the future, please leave that in the comments here. I'm having so much fun doing these videos. I hope you are too. If you find this useful, share this with your friends. And you guys have a great weekend. I will see you guys on another video next week. Bye-bye.